Are you familiar with a case involving an individual named Grace Jennings?
Yes, I am.
How are you familiar with that case?
This Miss Jennings had an autopsy performed in 2022, specifically October 31st, 2022, by one of my forensic pathology fellows, Dr. D. Pasquale. I supervised that examination, and then I finalized the autopsy report determining a cause and manner of death.
Okay. So in terms of supervising, you were present for every important stage of the autopsy?
I viewed Miss Jennings as she was received with her clothing still on her body. I reviewed her body after that clothing was removed, and then I reviewed her body after her body was washed. I saw every injury that was on her body, and I also reviewed her internal injuries as well.
Thank you. In this case, were you able to observe enough injuries and enough data points to draw a conclusion as to cause and manner of death in this case?
Yes.
Okay. And what is your ultimate opinion as to cause and manner of death?
Miss Jennings' cause of death is sharp force injuries, and her manner of death is homicide.
What's a stab wound versus an incised wound?
Stab wounds and incised wounds are both sharp force injuries. A stab wound is deeper than it is long, and an incised wound is longer than it is deep. A stab wound is exactly what we all can probably visualize, a deep wound caused by a sharp object, and an incised wound is a cut or a slice of the skin.
Thank you. Can you, let's now turn to Grace's autopsy and discuss that. What were your overall findings about Grace in terms of her stages of development, nutrition, or nourishment, the overall initial observations?
Miss Jennings was a healthy appearing 21-year-old woman. She was thin, but she otherwise looked like a normal 21-year-old woman.
Okay. Yeah. And when she arrived, was there any evidence of attempts at medical intervention or medical assessment prior to arrival at OMI?
Not significantly. I believe she may have had an EKG pad or a sticky sticker that EMS places on her leg, but otherwise she did not have any significant medical intervention, no.
Okay. Any evidence of any sort of underlying natural diseases that would have been involved in your opinion?
She was a healthy young woman on my exam.
Okay. Can you very generally describe the overall injuries to Ms. Jennings, and then we'll review them in more detail?
Ms. Jennings had multiple sharp force injuries on her body. She had 12 stab wounds and at least 8 incised wounds, so 12 stabs and 8 slices. She also had additional incised wounds on both of her hands, so greater than 20 sharp force injuries.
And I see in your report you have the evidence of injuries broken down in categories from A to U, as in umbrella. Is that an appropriate methodology to take in terms of talking about her injuries?
Yes.
Okay. So injury category A, what was that?
If it's okay, I'd like to refresh my memory with my report so I can track along with you.
Sure. Your Honor, given that Dr. Helmrich is an expert witness, we'd ask that she be able to utilize her report from the counsel table. Both parties have that report.
Any objection?
No objection, Your Honor.
Go ahead.
Right, thank you. So the wound on Ms. Jennings' body that was designated A is an incised wound or a cut that was on the right side of her neck.
And I guess I should back up. Are you able to make determinations if injuries are rendered before, during, or after someone dies?
Sometimes we can say that, and sometimes we can't.
Okay, can you explain that a little bit more to the jury?
Just like we talked about earlier with having a blood pressure, if a person sustains an injury while they have a blood pressure, that injury will be bloody in the tissues. If they sustain that injury after their heart has stopped beating, then that injury will not be bloody in the tissues.
What can make something indeterminate? Why would you sometimes not be able to render an opinion on if it was before or after death?
It can sometimes be hard to put an injury definitively in one of those categories if a person sustains an injury while they have a very low blood pressure. So when they are dying actively, or if the injury is very small and doesn't involve much tissue, then it can also be hard to say.
Okay, thank you. As to the category A, the wound on the right upper side of the neck, are you able to offer an opinion as to whether that was before or after death?
The wound on the right upper side of her neck, designated A, is most likely post-mortem, meaning it occurred while Ms. Jennings did not have a blood pressure.
And why do you draw that conclusion?
The tissues in that area were not as bloody as I would expect for injuries sustained in a living person.
Thank you. As to category B, what injury did you classify under category B?
Category B is a stab wound of the right side of the neck that was underneath wound A.
Would you mind gesturing on your own neck and body where A is and where B would be?
Sure. So wound A was an incised cut.
And for purposes of the record, you're using your index finger to kind of point under your ear along your right jawline, sort of. Is that a fair description?
Yes.
Okay. And category B?
Stab wound B was located underneath that, somewhere in this general area.
Okay. And for purposes of the record, you're using your index finger to point kind of on the right side of your neck, about midway between your neck and collarbone, or jaw and collarbone?
Yes.
Right. Thank you. Okay. What information can you give to the jury about that penetrating stab wound to the neck?
The stab wound B on the right side of Ms. Jennings' neck also I favor to be post-mortem, meaning it occurred after she died. The tissues were not as bloody as I would expect for a living person.
Okay. Are you able to make a determination as to the direction of that injury?
Yes. Referring to my report, wound B, stab wound B, was right to left and downwards.
Thank you. Going to category C, what was that injury?
Wound C was another stab wound of Ms. Jennings' neck. This time, this stab wound was located on the left upper part of her neck in this general area.
And again, for purposes of the record, you're using your index finger to point on your left jawline, or just below your jawline.
Exactly.
All right, thank you. Were you able to, what information about the path of that injury can you provide to the jury?
Referring to my report, that direction that the knife took once it entered her body was left to right and slightly downwards.
Okay. And you just used the word knife. Is that a conclusory statement about the type of implement that was used?
No, that's me just using a broad term for a sharp object.
Were there any internal injuries associated with category C, this penetrating stab wound of the left neck?
Nothing significant. This wound did injure her airway, but I do favor that that's a after-death injury.
Okay. Moving to category D, is in Delta. What was that?
Wound D was another stab wound of Ms. Jennings' neck that was located on the bottom part of her neck, somewhere in this area.
And you're gesturing right between your collarbones at the very base of your neck, top of your chest. Is that correct?
Yes.
All right, thank you. And what can you tell the jury about any associated injuries and direction of the injury?
For the direction for this wound was front to back and downwards. This wound cut Ms. Jennings' right carotid artery. That's a large artery that is comes from our chest and then extends up through our neck to our head. This wound occurred after she had died.
And why do you form the opinion that that carotid injury would have happened after she died?
This is one of the wounds that I can be definitive about. The carotid artery is a large artery, and if you have a blood pressure, it will bleed a lot. So the absence of bleeding in that area means her heart was not beating when she sustained that wound.
Have you reviewed photographs from the scene of death?
Yes.
Okay. And in those photographs, there's blood in a spot on an area on the floor, and there's blood on bed and bedding. Did you review those photographs?
I did.
Okay. To a layperson, that may appear like a very bloody scene. To a medical investigator, how bloody does that scene appear to you?
It's kind of hard to say. There's such a spectrum, and it depends on how many wounds a person has, but the amount of blood at the scene was within what I would expect for a person who died from sharp force injuries.
Would you have expected more blood on the scene if the carotid injury had been while Grace was alive?
I hesitate to answer that without having seen the scene myself, but it's possible that that was not enough blood. I've definitely seen more blood at a scene with a person who is has a wound of the neck with a carotid injury. Yeah.
Thank you. But it is your opinion that that carotid injury was postmortem?
Yes.
Moving to a category of wounds that are defined as a wound track. What's a wound track?
A wound track is a path through the tissues and organs of the body that connects to things. So for a sharp force injury, that would be the path that a sharp object takes once it enters the body. What did it pass through inside of the body?
Okay. So if I stabbed through my hand with my pen, would one side be, say, A, and the other side could be B to form that wound path?
Exactly.
Okay. For the first wound path broken down into category E and L, where were those entry and exit wounds located on Grace's body?
Yes, Miss Jennings had 2 holes on her body on her left upper shoulder area. One of those was on the front upper shoulder. The other was on the back upper shoulder. And those 2 holes on her skin connected through a path inside of her body.
Okay. Did that wound path, E as in echo, L to Lima, involve any major organs or structures in Grace's body?
No, although the designation E also includes a separate stab wound, that did.
Okay. And where did that separate stab wound under category E fall?
That separate stab wound was on the front of her left shoulder beneath the other hole, also designated E. That stab wound entered her left chest cavity.
For purposes of the record, you've taken your right arm and crossed over your chest and designated to your left upper shoulder and then below, or where your shoulder and your chest kind of connect, and below that point for the second stab wound. Is that correct?
Correct.
Okay, thank you. And if I misuse the term for a body part, please correct
I
me.
will, yes.
All right. Is there anything else you'd like to inform the jury about regarding either category E or the wound track from E to L?
No, just that it may be confusing, but what we just discussed was 2 separate stab wounds.
But because of their general area, you broke E. You categorized 2 wounds under E because they were in the same area?
Exactly.
All right. So now going to category F, as in Frank, and its wound track into N, through N as in Nancy. Can you tell the jury about that?
Yes, this also represents 2 separate stab wounds. So Miss Jennings had 2 stab wounds on the front of her chest. That's designated with the letter F. One of those wounds traveled through and was associated with a hole on her right upper back. Another stab wound, the second stab wound of F, just entered into her chest and did not come out her back.
Did those wounds involve any major organs or structures in Grace's body?
Yes, the wound F that also was associated with a wound on her right upper back injured her right lung, and she had a little bit of blood in her chest cavity and air in her chest cavity from that.
Why is it bad to have blood and air in your chest cavity?
Our lungs need certain pressures to be able to stay open. That's how we breathe. So when something enters the chest cavity like a wound, our lung can collapse, and that would make it very difficult for a person to breathe if an entire lung collapses.
Would this wound, F and the F to N, would these be fatal injuries?
They could be, yes.
Okay. And do you have an opinion as to whether these injuries were inflicted while she was alive or deceased?
I do favor that these two separate wounds, F, could certainly have occurred while she was alive. It's my opinion that it's most likely that that's what happened.
Okay. Is there anything else about these categories of injuries before we move on to G and associated wound tract M?
No.
Okay, then let's talk about category G as in golf and M as in Mike.
G and M is one stab wound that is also associated with two holes on Miss Jennings' body. So there was a sharp force hole on the skin of her upper back, and that connected to a small hole on the front of her right shoulder. And that wound was a sharp force injury. Yeah.
Are you able to say the entry and exit point for the wound tracks? For example, are you able to say that the whether it's a knife or sword, that the sharp instrument used entered through the back and exited the front, or vice versa?
For Miss Jennings' perforating wounds, meaning the wounds that both entered and exited her body, this is the only wound that I can say the direction. The direction for this wound was back to front.
Thank you. Did this category, or did this stab wound, G to M, impact any major organs or structures in Grace's body?
It also injured her lungs.
And do you have an opinion on whether this was inflicted prior or after death?
This is one that is possible that it happened while she was alive.
Anything else about the G to M wound track that you would like the jury to know?
No.
Okay. Let's move on to category H. What was category H?
Category H was a very small cut on Miss Jennings' body that was located on her right arm, almost the front part of her right shoulder near the armpit.
Do you have an opinion on, you said it was a very small wound, but are you able to form an opinion on whether it was pre or post-mortem?
I can't be definitive about if this one occurred while she was alive or not, no.
Okay. Let's move on to category I, as in India. What is category I?
Category I represents multiple cuts on Miss Jennings' hand, on her right hand specifically. She had cuts on the front of her index and middle fingers. She had a cut on her palm near the base of her thumb, and she had a cut at the base of where her pinky is on her palm. She also had a cut on the side of her pinky. And so group I represents all of these hand cuts.
And for purposes of the record, you just held up your right hand and used your left index finger to demonstrate where those injuries were on your own hand.
Yes.
Thank you. Do you have an opinion on whether these were pre or post-mortem?
These injuries occurred while Miss Jennings was alive.
And why do you say that?
The tissues were bloody and bruised in these areas, and that would only happen if her heart was pumping.
Let's move to group J, as in Juliet. What injury cluster group is that?
Group J represents multiple cuts on Miss Jennings' left hand. Those were located on the front of her index, middle, and ring fingers. They were also located on her palm, and then she had a small cut on the back of her middle finger.
Do you have an opinion on whether those wounds were sustained while she was alive or deceased?
These cuts on her left hand were also while she was alive.
And why do you draw that conclusion?
The tissues were bloody, and so she had to have had a blood pressure.
Category K is in kilo. What injury or group of injuries fell into category K?
K is just a single cut or incised wound on the front of Miss Jennings' right knee.
Would that be a fatal injury?
No.
Okay. And do you have an opinion on whether that was sustained while alive or deceased?
This one was not extremely bloody, but it was very fatty, and so I think it's possible that this could have happened while she was alive or after she died.
We've talked about L, M, and N as it corresponds to the wound tracks, so let's go to group O as in Oscar. What is group O?
Group O is a cluster of 3 stab wounds on Miss Jennings' lower back. They were very close together, and these just entered her body and did not exit her body.
Did these injuries involve any important organs or structures within Grace's body?
They injured her spleen, which is one of the organs that lives in our abdomen, and then it also caused bleeding in the tissues around the spleen.
Okay. Did it injure any of her ribs?
Yes.
Can you please just explain that to the jury?
Yes, so just referring back to my report, some of the stab wounds of her chest, as well as these 3 stab wounds, would injure her ribs as a sharp object travels through the area. And so for this cluster, group O, she had some injury to her left lower ribs of her left lower back.
Okay. Can you describe the wound tracks?
Yes, so for this cluster of 3 stab wounds on her lower back, the wounds entered through the tissues of her back, entered her abdominal cavity from behind, and then went between some of her ribs and cut her spleen and her diaphragm. That's the muscle that we use to breathe.
Would these injuries have been fatal?
They could have been.
And do you have an opinion as to whether these were sustained while alive or deceased? I may have asked you that already for this category. I apologize.
That's okay. You didn't, but I do favor that these occurred while she was alive, given the presence of bleeding in the tissues. And she also had some blood in her abdominal cavity.
Okay. Let's move to category P as in Papa. What was that category?
Category P is a cut or a slice of the left lower part of Miss Jennings' neck.
Okay. Do you have an opinion on whether that would have been pre or post-mortem?
This wound occurred after she had died.
And why do you say that?
Because this area would have been very bloody if it was injured while she was alive, and it wasn't.
Okay. Going to category Q. What did you observe that you classified as category Q?
Wound Q is just a single cut or incised wound on the back of her left shoulder that just injured the skin and the underlying fat.
Do you have an opinion on whether this was pre or post-mortem?
I favor that this occurred after she died, but I can't be definitive.
Going to category R as in Romeo. What injury was this?
R is a stab wound of Miss Jennings' right side of her belly, and that wound traveled into her abdominal cavity, injured her diaphragm, that breathing muscle, and also damaged her liver.
Could these injuries have been fatal?
Yes.
And were these injuries sustained pre or post-mortem?
I cannot say for sure one way or another for this wound. It's possible that she had been alive, but it's also possible that she hadn't.
Let's move to category S as in Sierra. What injury or category formed S?
S is a single slice wound or a cut of the back left portion of Miss Jennings' scalp on the back of her head.
Can you please gesture on your own body where that would be?
In the general area.
Okay. And you've just used your left hand to demonstrate kind of just above your ear line, further back on your head. Is that correct?
Yes.
Great, thank you. And what can you tell the jury about this injury?
This injury just injured the skin and the underlying tissues, and there was not a significant amount of associated bleeding. I do favor this occurred after she had died.
Okay. What was the state of her hair around that injury? Do you recall?
I don't recall off my recollection. I don't.
We're going to look at the photos in a little bit. Will that help you remember?
It could, but we also shaved the hair to see the wound, so it may not, but I'll try.
Thank you. I guess I should have asked that question, whether you altered the hair as part of your autopsy.
We did.
Going to category T as in tango, what injury or injuries fell into category T?
Category T was another slice or a cut on the back of Miss Jennings' neck, kind of where our scalp will meet our neck.
Can you gesture on your body where that is? And you've just lifted up your hair and used your right hand to point almost directly in the back at the base of your skull. Is that fair?
Yeah.
All right, thank you.
I'm sorry, I didn't get a verbal answer.
Yes, thank you.
Do you have an opinion, or did this damage any structures or organs?
Just the tissues and skin.
And do you have an opinion as to whether category T is an injury that would have been inflicted pre or post mortem?
This injury also occurred after she had died.
Let's go to category U. What is category U, the final category of injury?
U is a single slice or cut wound of Miss Jennings' back of her head. This was located on the right part of her scalp above her right ear.
And does this injury appear similar, kind of mirroring injury S?
Yes.
Okay, so there's kind of two slice wounds, one on each side of her head above her ears?
Yes.
Right. Would this injury have been inflicted pre or post mortem?
This injury also occurred after she had died.
And that's because of the lack of bleeding in the tissues?
Yes.
So we've talked about a number of injuries and a number of ones that could or could not be fatal. Can you just explain to the jury how did Grace die? What was injured that led to her death?
So Miss Jennings had wounds on her hands, cuts on her hands that occurred while she was still alive. So she was in contact with a sharp object while her heart was beating. She had wounds of her head and neck that largely occurred after she had died, and she had wounds of her chest and back and abdomen that at least one of these had occurred while she was alive. She had blood in her abdominal cavity and some blood in her chest cavity, and that would really kind of only happen if she had been alive while she sustained these. So at least one of the wounds of her chest and abdomen caused her death.
And how specifically? Did she bleed out? Can you explain that to the jury?
Yeah, so Miss Jennings, first and foremost, had air in both of her chest cavities, so both of her lungs were collapsed. If that had occurred on either side of her chest, that could have caused her death, but it occurred on both sides of her chest, and so that certainly could have been fatal. Her lungs would not have been able to expand to allow her to breathe, especially in combination with injury to her diaphragm, that muscle that helps us breathe. She also had injury to her spleen, which was associated with some bleeding in the tissues nearby. So she did have some blood loss in the tissues at that area. And then she had a little bit of blood loss in her belly and her chest cavities.
Are you able to form an opinion on how long it would have taken Grace to die from the time that the fatal injuries were inflicted? How long from when the fatal injuries were inflicted until she would be dead?
Miss Jennings did not have any immediately fatal wounds, so it would have taken her at least a couple of minutes to die.
Thank you. Is there anything else you would like the jury to understand about the injuries before we view the injuries?
No.
I guess quickly, in terms of after your autopsy, did your office collect specimens that were sent for toxicology testing?
Yes, we did.
Okay. And did you receive the results of that toxicology testing from the state certified laboratory?
Yes,
Okay. And did you review those as part of your case?
I did.
Okay. And what specimen was analyzed, and what, if anything, resulted in the toxicology testing?
And just to clarify, it was not the state laboratory that performed this testing. It was another laboratory that we send all of our toxicology to, an accredited lab called NMS Laboratories.
Thank you. So, but it is an accredited lab that the Office of the Medical Investigator uses?
Yes.
Okay. And you rely on their test results as part of your expertise, or informing expert opinions?
Yes, us and other medical examiners across the country.
So what specimens were analyzed, and what, if any, positive results came through?
Ms. Jennings, we sent her blood and urine to this laboratory for testing. They did not detect any common drugs or alcohol in her blood at the time of death. They did detect cannabinoids, which is similar to marijuana in the lay term, in her urine only. So that was not present in her blood, but it was present in her urine.
What does the fact that it was present in her urine but not her blood tell you?
It means that that substance would have had no effect on her at the time of her death because it was not circulating in her body. She had used cannabinoids at some point, and it was now just sitting in her urine as it had passed through her body, her kidneys.
So in other words, Grace would have been sober at the time of death. Is that fair?
Yes, there was nothing detected in her blood.